First of all, absolutely, I think that that is quintessentially what a mayor should be doing. Mayors deal with problems that concern the entire city and not just a particular district. And so there's both fully pulpit leadership, but there's visioning about where it is that we should go. And the public health in our community is very, very important, and the mayor should take a leadership role in doing that. So what are some of the things that can be done in order to increase the public health? Well, awareness is one thing, and the awareness has to go with the acknowledgement of who lives here. 33% of our children live in poverty. Over 20% of our residents, or 19% of our residents, live in poverty. And there's a great correlation between poverty and the kinds of diseases that we're talking about. So we have to acknowledge that. We've got to work with our public health department and all the grants that they give to do all these programs in order to assess what's going on. But specifically, I would promote safe routes to schools with Long Beach Unified School District, using funds from the state to help kids learn program, to teach them about bike safety, encourage bike to school days with the Unified School District, help schools integrate healthy choices, healthy living options into their curriculum, and promote the healthy practices that we can go ahead and do by just saying that this is an important issue for us.
Is everyone number one?
Thank you. Adding on to what Mr. Otto said, 70% of the kids in Long Beach Unified are eligible for free and reduced lunch. So if that's the case, one can only imagine what the nutrition must be at home. We in Long Beach are really fortunate that we have our own health department. We have a new head of the health department, his last name I can't remember, Kelly Colapi. And I think we're fortunate to have her because she sees the holistic view of health. It is not just disease, it's all about prevention and lifestyle and how we integrate lifestyle into our homes, into our schools. I think it's important that we work together collaboratively with the school district to make sure that health studies are put back into the high school because they have been dropped, and so there is no opportunity for students to learn about health. It's also important to know that California Endowment does have a program that works on nutrition and good health and all aspects of good health, that includes mental health, in certain zip codes in Long Beach, and it's been very, very effective.
In fact, we are part of the Healthy Cities Coalition in the city of Long Beach because we do feel it's extremely important. You know, it's a solvable problem, but it's a very complex problem. When you have so many people living in poverty and do not have living wages, it is so easy to buy junk food. And if you look in many parts of our community, they don't have access to healthy, fresh food. So encouraging community gardens, encouraging stores to provide healthy, good food for people would be a great start. And we have to have access to fun and physical activity for kids. Kids just don't want to be told they have to exercise. They want to do something fun around it. And I think they can't do that if we as a city don't take care of public safety. If in their own neighborhoods, in their own parks, their families don't feel it's safe for the kids to get out there and play, they're not going to do that. So in terms of what the mayor should do, the mayor should make certain that all parts of the city of Long Beach are safe so that we can encourage people to connect and use the community. And we didn't talk about the respiratory problems, but we also need to address the fact we have the highest rate of asthma in this city, and that is because of port pollution, which we've worked on, but there's a number of other impacts on adjacent communities that we haven't dealt with yet that have to be, otherwise kids will not go out in the neighborhood and bicycle.
Thank you. Mr. Garcia.
I think that this is a critical issue for the city, and we got to make sure that Long Beach is healthy and that everyone, no matter your income level, where you live, that we all have access to a healthy lifestyle. We've done some good things over the last few years. We've made sure that our public vending machines don't carry an overburden of sugary foods, and and bad foods. We've put in a corner store conversion program to go into some of these local markets and ensure that they're providing some fresh foods to the neighborhoods. We've added farmers markets. In my district alone, we've opened up 3 community gardens. We're doing that citywide as well. So those are things that have been good. I've authored the Let's Move Long Beach initiative, which has been a series of fitness events as well as health fairs that have happened, just to give people an opportunity to understand what it means to have a healthy lifestyle. There's additional things we need to do, obviously. We need to ensure that we continue to open more parks, particularly parks with active spaces, fitness zones, places where people are able to interact with their families. We need to pass a comprehensive urban agriculture policy. We need to encourage people to take advantage of growing their own foods, their local foods. That's an incredible way of also teaching people about healthy foods and the options that they have in front of them. So these are just some of the items that we can do. I think also at the end of the day, we've got to lead by example. I agree with what was mentioned before. We've got to get into our schools and make sure that the training is right, that people understand that kids today are just, they're more unhealthy than they've ever been. And the obesity rate in Long Beach, particularly in communities that are low income, is something that really should be unacceptable to all of us.
Mr. Camp.
I think we sort of need to get back to fundamentals when it comes to our personal health. Honestly, we need to put a little less faith in the FDA and a little more in how things make us feel. Particularly things like high fructose corn syrup. I'll tell you, that stuff is probably the primary cause of childhood diabetes. It's turbo sugar, goes into your system without being properly digested. These kids are having roller coasters now. Their glands are trying to counter it. It's up and down, up and down. And meanwhile, they're having mood swings. I'll tell you, you want to raise your kids, it's not going crazy, don't give them anything with high fructose corn syrup in it. There are many ingredients that we just need to take out of our diet. I think a lot of people need to start studying the impact of heavy metals in their diet. Again, there's a Romanian laboratory that conducted a study on heavy metals in wine. One of the best things I think the mayor can do is be a healthy example. I personally, if I could afford it, I would be eating a lot of organic food. I think one of the first things I would do is encourage vertical farming. Let people grow fruits, herbs, all kinds of stuff. We could probably have 1.5 acres of fruit on the walls in here. Again, if you want to be healthier, take a close look at your environment. The things that are around you, the quality of your air. We're going to give a